Why is maternal and child health so important to Rotary? Because the health of a child depends on the health of the mother. If the mother is healthy, her children will be healthy, and the society they live in as a whole will be healthy as well. Please watch the District 5370 April message.
Every 2 minutes, somewhere in the world, a woman dies from preventable causes related to pregnancy and childbirth. And babies whose mothers die within the first 6 weeks of their lives are far more likely to die themselves than babies whose mothers survive. Until the beginning of the 20th century, men usually outlived women by many years. The reason for this was that large numbers of women died from the complications of childbirth and pregnancy. Families with 10 to 14 children were common, and the high birth rate was accompanied by a high infant and child mortality rate. Women who gave birth to a dozen children often only got to see 4 or 5 of them survive to adulthood. The causes of infant and child mortality were lack of safe water and sanitation, lack of food security, and lack of vaccinations and even basic medical care. Sadly, these conditions still exist in many parts of the world, and the maternal and child death rates are like what developed countries had 200 years ago. April is Maternal and Child Health Month, and Rotary International has made maternal and child care one of its areas of focus. There are hundreds of projects funded through RI Global grants around the world, as well as partnerships with other like-minded organizations. Rotary makes high-quality healthcare available to vulnerable mothers and children so they can live longer and grow stronger. We expand access to quality care so mothers and children everywhere can have the same opportunities for a healthy future. An estimated 5.9 million children under the age of 5 die each year because of malnutrition, inadequate health care, and poor sanitation, all of which can be prevented. Rotary provides education, immunizations, birth kits, and mobile health clinics. Women are taught how to prevent mother-to-infant HIV transmission, how to breastfeed, and how to protect themselves and their children from disease. In Haiti, one of the poorest countries in the world, and where it's estimated that half the women are illiterate, Rotary provided a fully equipped medical jeep so that volunteers and midwives could reach mothers and children in remote areas.
Because of the Jeep, we're going to be able to run these mobile clinics to include places like Delhi Grande that we haven't been able to go to because of distance. The plan is that once a month, women will be able to be seen at these far-reaching places.
Votre